today. I really appreciate the invitation from the center, including the Center for Healthy Living. And a special shout out to Carl Enzer, Lynn Fischel, Brett Klein, who helped me with the presentation, and also to Shannon Hartsook from our IT department, who's helping to make sure that all the technology is working correctly. This is Heart Month, and so I think it's a nice opportunity in the midst of Heart Month to talk about a topic that really is important in terms of not only overall, but specifically cardiovascular heart well-being. I am a recently retired RN from Eisenhower. I've been a nurse for 45.5 years, and I spent almost 30 years here at Eisenhower working as a registered nurse. My most recent position was as the director of the Ranker Wellness Center, which is where we host our cardiac and pulmonary rehab programs and our heart failure clinic. Prior to that, I worked for over a decade as the director of the education department, and my clinical practice has been within the field of cardiovascular nursing from pretty much the entire continuum of care, starting out working in post-op heart ICU many years ago, and having had the privilege of working as a hospice nurse over the course at different times during the course of my practice. So that's my nursing practice. Probably 25 years ago, like many of us, I believe, I was going through some challenges in my life, and I needed to pick up some tools in order to be more effective in my professional life and to be happier in my personal life. And a mentor encouraged me to look at meditation, which was pretty scary to me because I did not know how to sit still. So I decided to try it, and I will tell you that if you will stick with it, and I'm hoping to give you some options to make it work for you, it will change your life. And during the busy lives that we all lead, whether we're still in the active workforce or retired, it's wonderful to have a place to go to center and to have a quiet place where we can find some peace. And I believe meditation is a source for that. So during today, this is our agenda of what I hope to cover. Please feel free, as the chats are available to you, to give me information as to what you were hoping to get today during our Q&A. If I didn't touch on it, I certainly would hope to circle back. I want to be respectful of your time and the commitment that you've made to be here today, and I'd like to honor that. So these are the things, in addition to circling back with you at the end. What is meditation? What does it mean to different people? What are the types of meditation? And I'm going to go over several. I'm not going to, it's not a course in meditation, obviously. What are the benefits? This is Heart Month. I was asked to speak to cardiovascular benefits that include both the heart and the brain. And those cardiovascular can cover both of those. We're going to have time for a short practice that I will hope that you join us in. At the end of the slide deck, which is really quite short, there are, though, a number of different types of resources. I think of meditation as a tool, and so I wanted to share some additional tools with you in a variety of formats, hoping again that it might be an opportunity for you to find something that would be of benefit to you in the long term, but certainly today to benefit you in the hour of time that you have offered up for us. And then we'll wrap up with Q&A and all at the end. So there are many, many definitions of meditation. I chose to share with you two that I think encapsulate it, but I've also found to be particularly effective. Jon Kabat-Zinn started work with meditation as long ago as the 70s. And I like his definition because it's so simple. Meditation is the intention to pay attention. It's nothing more than that. Recently, I had a cardiac rehab participant who shared the book by Sood that's listed here with me. It's from Mayo Clinic, and it is their handbook for happiness. And Dr. Sood defined meditation as an intentional, relaxed presence. I think really important is the word presence that is offered with a compassionate, non-judgmental, grateful disposition. And I really liked that because I thought it's similar in many ways to what Kabat-Zinn shared, but it's also broader. And I think as we look at the benefits of meditation, the disposition that we bring to a practice is also important. The word cloud that's there gives a lot of other words that are associated with meditation, certainly mindfulness. Mindfulness is solely about being present in the moment. So there again, the importance of presence. And I think that we hear a lot about mindfulness in our popular culture today. It's a type of meditation. So those are a couple of definitions that I found helpful. Again, there are others, but I hoped that those might set the stage for us. So what's the goal of meditation? I'm going to pay attention and try to bring a calm disposition. The goal really is to bring a calm, focused, relaxed mind not only to our practice, but to our lives. And as I was reading Sood speaks to the availability of equanimity using meditation. And I think that also goes with the definition that Sood provided, which is equanimity is having a calm composure, even in the face of a difficult circumstance. I'll share an example. Years ago, 25 years ago, I guess, when I started to learn to meditate, I was pretty reactionary. I was go, 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 adrenaline driven, let's do it now, blah, blah, blah. And I worked as a nurse here at Eisenhower on one of the tele units. And on that tele unit, from time to time, we would need to call the emergency team to assist us in the care of someone who was in extremis. 25 years ago, Eisenhower was a much smaller hospital, so there weren't as many people coming to call when we would have an overhead page that we needed some help. And as a charge nurse, I was often the person, if it happened on my shift, that needed to be in the room. And usually I knew the drill, I knew the things to give, and under the direction of the physician, but I was pretty confident of that. It was on a code, and I remember it to this day, after I had started my meditation practice, that I walked into that room and I could see the room. I was able to bring equanimity to that situation. And it was an amazing feeling because I wasn't reacting and pinging off of everything. I was able to be calm, and as a result, I could offer responses versus reactions. And in your resource book, Kabat-Zinn, in his wonderful book, Full Catastrophe Living, talks about the difference between reacting and responding. Often in our world today, we do a lot of reacting. I need it now. What about this? What about this? What about this? And we can answer that call. What I'm suggesting to you is that with a regular meditation practice, we're able to bring more of a response, which is the ability to, I don't mean you don't answer someone, but to be in a place that's more centered so that when you do, it is more likely to be a response that has is less likely to cause a challenge than perhaps that knee-jerk reaction. And I hope that makes sense to you all to appreciate that difference. Another goal of a meditation practice is the impact it has on our nervous systems. So the two main nervous systems are the sympathetic nervous system, that's our adrenaline, that's our flight or fight response. And we'd like to be able to reduce that unless we are actually in danger, and be able to enhance our parasympathetic, which is the opposite nervous system. And that nervous system allows us to be less reactionary. So those are three significant goals to a meditation practice, and we'll talk about them a little further. What are the types of meditation? And again, this is not an all-inclusive list. Sue talks about 4 different types, and then I added an additional one from Gupta's recent book. So attention-based is what Kabat-Zinn talks about. We are going to practice an attention-based short meditation later in the hour. And the easiest one to me that's attention-based is following the breath, but it can be other things. If you enjoy sitting on your patio early in the morning, you can do a meditation on the birds that are singing. It's your intention to pay attention to that. A feeling-based might be with gratitudes as an example. I want to be able to be grateful, and so I start my meditation thinking about the things in my life for which I'm grateful. And as I continue to think about those things, I notice that my feelings start to lift. So instead of being anxious and agitated, if I've gone through things that for which I'm grateful, then my feelings have probably also elevated. Or perhaps I think about someone I love or a place that I love to be. And that can be a feeling-based form of meditation. Thought-based, that might be with a mantra, and you might use that. It might also be prayer. Prayer can definitely be a form of meditation. And so as you are praying, that also is allowing you a means of paying attention. Then another that I find also to be very helpful and is when meditation is not the goal. Meditation is something that sort of is in the background. So Tai Chi to me is a beautiful example of that. And I, wherever you do Tai Chi, but in my mind, when I say Tai Chi, I see the people in China on mornings with their lovely, graceful movements. And that is a form of a moving meditation. You might walk a labyrinth, guided imagery, where in your mind someone is sharing with you a scenario that is bringing you to a place of relaxation. And there are literally millions of these online. So if you find that to be helpful to you, on YouTube or any number of apps, and I've listed some on your resources, you can find those options. A progressive muscle relaxation is another form of that, is the body scan that Kabat-Zinn speaks of in his text, Full Catastrophe Living. And basically you start at your toes and you go to the top of your head and you contract a muscle and then you relax it. And then you contract it and you relax it. Or another way he teaches it is you breathe through that part of your body. So it may sound weird to think about breathing through your feet, but your mind can actually help you with that. And in so doing, it helps you to relax. The body wants to do what the mind tells it. So we have a lot more control over some of these things than we ourselves may recognize. Recently, because stroke and the brain was listed as areas for discussion for this, I wanted to see what I might be able to find specifically related to the brain. And most of you are probably familiar with Sanjay Gupta, the physician on CNN and other places. He is a neurosurgeon, so he knows of what he speaks, and he devotes information in his new book, which is listed in your resources, on what he learned in spending some time with the Dalai Lama as relates to meditation. So, as an example, he's spending several days with the Dalai Lama, and this particular morning, they are going to spend some time in meditation. And Sanjay was not real keen on meditation because his mind was going all the time. And many of you, like me, understands that little dilemma. So, but he thought, okay, I'm with the Dalai Lama. I got to, do this. So they were sitting quietly, and after a few minutes, the Dalai Lama says, "How are you doing? How's it going?" In his quiet voice. And Sanjay, I think, sort of crumpled in many ways, but answers, "I'm really having a hard time here. This is hard for me." And he was so relieved when the Dalai Lama said, "I know, it's hard for me a lot of days too." So this from this master who has meditated many, many decades. And he said, "May I share a tip with you?" And of course, Sanjay said yes. He says, "This is what I do. I think of a problem I'm trying to solve, and I create a little bubble up above my head, and that's my little bubble where I'm going to put my problem. And I close my eyes and I set myself up for my meditation, and I see in my mind's eye that my problem is placed in my little bubble. And then I start to work through it. And sometimes I come to a solution and sometimes I don't, but I find that that is helpful." So I thought, well, I've never done that before, so I thought I would try it. And I had something that I just couldn't seem to quite let go of. So I thought, let me try it. Let me try this out. And it was really interesting because I did as suggested. I saw my little bubble. Again, our minds are so powerful. They'll paint all kinds of pictures for us. So I had my little bubble, and in my bubble, I placed my problem, and I took a few breaths, and I started to think about the issue and what was it? And as I processed it, what were my expectations? What had happened? What were the outcomes? What were the benefits? What went wrong? And by the end of it, I probably sat with it for 15 or 20 minutes. Nothing had happened that was untoward. I just had an expectation that wasn't met. So it has helped me be able to not be quite so charged about it, but to kind of relax about it. It just didn't work out like I thought it was going to. Nothing bad happened, but I used his form of meditation, and I share that with you. Perhaps you find that helpful. I think that different types of meditations are helpful, some more so in some situations than in others. And if you think of meditation as a lifestyle or a life skill tool, then you pick it up in a way that works for you at any given time. And I think that that allows us and really invites us to use it in that way and not to come with expectation or judgments. Remember, Sud said, non-judgmental. We just are present. Presence is so important. So those are a few types of meditation. There are others. There's transcendental. I'm sure there's a host of others. But my goal in talking about types was to give you the opportunity to consider some as options for you and who you are in your life. So what are the benefits then? We've talked a little bit about what it is, what are the types, what are the goals. So what are specifically the cardiovascular benefits? And I want to share with you a little bit about another one of the ways that I got interested in meditation. Remember, I'm a cardiac nurse. And when I started to look at this, back in the late 70s at Mass General and at Harvard, Dr. Herbert Benson was then a cardiologist, and he was working on the relaxation response. So he was there, and he was working in conjunction with Joan Borisenko, also on your resource list, really the person whose work taught me how to meditate, and Jon Kabat-Zinn. So Joan Borisenko was an oncology researcher at that point in time. She went on to become do many other things in terms of mindfulness and lifestyle. And her colleague, Jon Kabat-Zinn, was working with oncology patients back to offer them basically hope. Back in the late 70s, there was not a whole lot going on for both folks with cardiovascular disease or cancer. Cancer at that time was still pretty much a terminal illness. And heart disease, I was a nurse during the time of the term cardiac cripple. We didn't have stents and mitral clips and defibrillators. We had pacemakers that were sort of archaic, but we were doing heart surgery then. You could have bypass, but it was pretty brutal in terms of the assault on your body systems. So at that time, if you had a heart attack, you might spend a month to 6 weeks in the hospital because we didn't let you do anything. We thought we had to have you rest. Now, we did damage to a lot of folks because we didn't have the evidence to know that. But if you had heart failure or severe coronary disease or severe valvular disease, there often wasn't a whole lot to offer you, except people were told, get your affairs in order and go home and enjoy your life in your chair. Chair rest was actually assigned to people, prescribed. So in this setting, just think of all I'm so in awe sometimes of over the course of my nursing practice, all the changes that have occurred in terms of the things that we can do. I know in terms of cardiovascular disease, that includes heart and brain, but oncology as well, to help people that we just couldn't do back then. So at that time at Harvard and Mass General, they had started a group and they were teaching people to meditate, basically because they thought maybe this will offer something to someone. And they had started it with the oncology patients who liked it. And so they decided to add some of the cardiac patients to see maybe it will help them. Well, much to their surprise, they found that within 6 weeks, 96% of the people with heart disease that had been referred to this meditation group were having less angina. And angina is the medical term for heart pain. So it can be chest pain, you can be your tooth, your arm, whatever your heart pain is, that's angina. And so 96% of these folks in 6 weeks were having less of that. So that got a lot of people's attention. And it is from that initial work of Benson, Kabat-Zinn, and Borisenko that a lot of the mindfulness information in the literature and the benefits of meditation have come over the following decades. So there are wonderful benefits. One is that it's a really great way to increase your heart rate variability. Well, what's heart rate variability? It's just, does my heart rate go up and go down appropriately with my activity? So if you're climbing stairs, you want your heart rate to go up. But if you have a diseased heart, that really might not happen. And that has an impact on your ability to do those activities. So it helps with that. We have several stress hormones, but the one that's associated with chronic stress is cortisol. Cortisol is hormone secreted by the adrenal glands. It's also the hormone, an elevated amount of it is likely to give us the extra thickness around our middles. And so it helps to reduce that level. It reduces blood pressure. Let's jump back a little to when we talked about the different nervous systems, the sympathetic and the parasympathetic. And I said the sympathetic is the flight or fight response. So your brain is canvassing your environment at every moment to determine if you're safe or not. And today, it's not very often that we are in physical danger, but it's still the old brain. It still operates in the same way. And the body does what the mind is telling it. So as an example, if you go to the doctor's office, white coat syndrome, and I know they say that's not a real thing, but I'm here to tell you, I believe it is. So if we can, and that's because that sympathetic nervous system got turned on. Not because you were in physical danger, but what's the doctor going to say? What, are they going to ask me questions? Oh gosh, I haven't been taking that medicine quite like all those things. So your blood pressure and your heart rate go up because your sympathetic nervous system says, danger, danger. It's not real physical danger, but I might be embarrassed or the doctor might be upset with me or whatever it may be. I had a little bit of that preparing to come and start my time with you. What if this doesn't go well? What if I don't answer their questions? Blah, blah, blah. So I had a little bit of that. And a little bit of that's a good thing. It keeps us alert and it keeps us ready. Too much of it, though, is really damaging to the cardiovascular system. So a meditation practice helps to reduce blood pressure. It also helps to reduce anxiety and depression. When we think about heart disease, clearly the evidence has shown for decades, for someone who has a heart event, a heart attack, a hospitalization for angina, surgery, stent, whatever it is, a new diagnosis of heart failure, a third of those people would actually meet criteria for a clinical depressive episode. Most of those people, they go through it, it's situational, it goes away. But depression takes a toll on the pathophysiology of our bodies, in addition to our own emotional well-being. So it can help with that. And because it helps to turn down the sympathetic nervous system, it can help to reduce our anxiety by giving us a sense of calm and center. Even a single session is effective. Just one session. It's the consistent practice, though, that gives us lasting change. So let me share an example of a single session. In cardiac rehab, oftentimes people come in, everybody's racing to get to exercise, get their monitor on, get themselves set up, because as soon as this is done, they got someplace out, they're going to lunch or they're playing golf or they've got something else going on. So they come in and their heart rate's 110 and their blood pressure is 170 over 96. And we say, you're going to need to sit before you can exercise. And they say, but I'm racing to get here. And it's like, yeah, just for a couple of minutes. So we'll do the breathing exercise. Sometimes I would even pull up my chair and just sit next to them and do this exercise that we're going to do. And it's remarkable. In just a few minutes, the body goes back to center, because that's really what it's looking for. It doesn't want to live in this hyper alert state. It'll come back pretty quickly, usually. So that's an example in a single session when, or a single time, when you can reduce your blood pressure and reduce your heart rate. And we want to do that in cardiac rehab because we're getting ready to elevate it again, and we need for them to have a stable space in order to start. So I'm hoping that we've talked about what it is, types, goals, benefits, and now I'd like for us to take a couple of minutes to do a simple exercise, a simple meditation exercise. And we're going to do, I'm going to guide you right through it. It's really not guided imagery. I'm going to talk you through it. And this is based on the breath. And I like to teach breath because it's something you can do anywhere. Doesn't cost anything. You don't have to have any equipment. You carry your breath around with you, hopefully, all the time. So I'm hoping this can be a really simple tool, and it might get you to look at meditation in a different way, perhaps invite. So I'm going to ask you, if you will, to sit straight in your chair. Your feet are on the floor, please. Mother Earth is there. And your hands can be comfortable in your lap. I practice yoga, and touching thumb and forefinger stimulate the acupressure points of relaxation. So that's a comfort, and you'll see that sometimes. That's comfortable for me, not required. If you are comfortable to close your eyes, to close your eyes. If that's not comfortable for you, find a spot on the ceiling, the wall, the floor, someplace where you can focus your attention so you're not distracted. And we'll do a start, and I'll tell you when we're done. For the next 2 minutes, I want you, with your eyes closed, feet on the floor, hands in your lap, to simply follow your breath, to notice what it feels like when you breathe in through your nose. The breath travels down the back of your throat, into your chest, perhaps into your belly, and you breathe out. Simply following the pattern of your breath without judging it or changing it. Thoughts come into your mind, and they will. Allow them to pass through. It's almost like you watch them on a movie screen. You return your focus, though, back kindly and gently to following your breath for the next 2 minutes, beginning now. And when you're ready to open your eyes. I hope you found that relaxing. I'd be interested for any of, when we have time for Q&A, for any of your comments related to that. When I was a nurse working on a busy hospital unit, sometimes 2 minutes was about the amount of time that I had available. But I found even if I went to the bathroom and closed the door and took 2 minutes, it was amazing how my body would go back into a more relaxed, open space, and I could make much better decisions in terms of my my work that day when I was making those decisions out of response versus reacting. So when we, I think now we'll look at the resources, and the first one that's, I've listed them in different ways. John Borisenko's book, Minding the Body, Mending the Mind, is actually the little handbook, it's a little paperback I used to start to meditate. And I would set the timer on my kitchen stove for 2 minutes. That was it for me. I was wound pretty tight. And it took me months to be able to sit for 20 minutes. But some part of me believed that if I would just put in the effort, like they said, in time, my mind would calm down. And it was true. And it wasn't about doing it right. It wasn't about me judging how good a meditation it was. It was about me making time on a regular basis to sit quietly, sometimes not so quietly, with myself. And it will change your life. Sanjay Gupta's book is next. Then Kabat-Zinn's book. I've listed a couple of by him. You'll notice some of these are not new. They've been around for a long time. But I actually used to use Full Catastrophe Living as a text to teach a mindfulness class back a long time ago. It's a wonderful, wonderful book, and it's still available in paperback. His next book, Wherever You Go, There You Are short essays on mindfulness. Then Meditation is Medicine is written by a physician yogi, and that talks about meditation and how it can be used to heal. I'm not recommending you don't use both. Aren't we fortunate that we live in a world where we can use both integrative, complementary medicine and traditional allopathic medicine. And then Suit's book on from the Mayo Clinic on a handbook for happiness. It's a wonderful book. It's an easy read, but it talks about the pillars, and that includes sleep. I didn't talk about sleep, but meditation can be very powerful in helping with sleep. You can meditate as you go to sleep, perhaps. I'm not meaning that specifically, but if we are in a more relaxed, focused space of equanimity, then sleep seems to also come a little bit more easily. Then there are a couple of journal articles. If you will use Google Scholar, you can Google and find all kinds of things related to meditation and pretty much any form of health and well-being. These are just a couple. And then there are websites. The music that I just played for you now for the exercise comes from an app for Mac called Relax Melodies. There must be 25 different types, as well as guided imagery and other forms of meditation. Soothing Pod is also from Apple, and that's for iPad and iPhone. Has great, you can use it at night, similar to Calm, for either nature sounds, or if you want bedtime stories, or guided imagery, or different kinds of music, or guided meditations. So those apps are really helpful. There are many. Find one that works for you. As I mentioned, I practice yoga, and I think of Adrienne Mischler as my yoga teacher, although she's online. She's never met me, nor have I met her, but she's free on YouTube. You can buy additional access, but she wants yoga to be available for anyone who would like to have access. And in her practice, she is very inviting. So it's not about, can you get into pigeon pose without dislocating your hip, but more about guiding and nuance and paying attention to your own body and making moves that work for you. Every year at the beginning of the year, she does a 30-day practice. And I loved this year's because the 30-day practice theme was breath. So every day we worked on breath and breath with yoga. So I found, I highly commend that. And it's for all stages of practice, whether you've never tried yoga before and are pretty skeptical, or you're very experienced. Several years ago, she also did a 7-day class. It ran for 7 days. It's 20 minutes total, 15 minutes of yoga, followed by, that was to set the stage for 5 minutes of sit for meditation. So I find that to be helpful. And then the last one that's on there, I found on Netflix, and it's Headspace. And Headspace and meditation, there are multiple episodes, but I listened to the first episode, and it talks about meditation, what it is, what it isn't, and it's cartoonish. So it's light and easy. And I think there too is inviting to approach this with a light heart, as opposed to, I'm this harsh, I'm going to do this thing. So those are, I'm sure you all have other options that you would like to offer. And I happily have you share those with the folks that are also here with us. So at this point, I would like to see what kinds of questions you may have, comments, and get some feedback from you all.
Karen, we've got one question in the chat room, and then maybe Guillermo can unmute people, or people can unmute themselves as they have questions just to ask you. But Dan was asking, are there studies that indicate benefits to any certain minimum time of meditating in a day?
Great question. So yes, there are. And one that's I can specifically share with you is even 10 minutes twice a week can reduce your blood pressure. So I'm so glad you asked that. Sometimes we think about yogis or monks that are, hours on end, and that's not what this is. The most important thing is to have some consistency to practice. Start small, gradually add minutes. Don't try to sit the first time for 30 minutes. I imagine you'll get frustrated. But thank you for the question. Did I answer you? Okay. I see your head nodding. Thank you.
Okay. Everybody can open themselves the microphone if you want to just interact with Karen and with us here. So feel free to unmute yourself.
I'm curious as to why some of you signed up to spend this time together. What were you hoping to get out of this, and did I address what you hoped to have addressed?
We can just kind of go around the screen if you want, because I'm just going to go ahead and get the ball rolling, and we'll start with Dan. So, Dan, what were you looking for today?
I have been an off and on meditator for a long time. And so what I was looking for today was reinforcement of what I've already heard, wanted more information about the benefits directly to the cardiovascular system, and also any tips for helping to make it a regular practice, because I will go through a period where I'm meditating some amount every day for 2 or 3 weeks, and then oh, I skip it this day, and then it becomes easy to skip the next day, and then it's like 2 or 3 weeks before I meditate again. So if there's any tips to help about how to help stay on the track, I'd appreciate that.
Sure. I think that that's like exercise or anything, right? So to decide for yourself, I think to make it every day, that's really tough. Maybe you make it 3 times a week. And maybe to start, I'm going to try for, if you were me, it was 2 minutes, but maybe you're quite that tightly wound. And so 5 minutes might be okay. I think goals are important. I think goals help us as long as we don't use them to then berate ourselves about how we failed. So I hope that that's helpful for you. Do any of the others of you have thoughts about that?
I sort of feel the same way. I've meditated before, but I go through periods where I don't. And when I start, I think I try to do 20 minutes when I start back up. That might be a mistake. But this 2-minute one that you did today, I don't know whether it was the fact that more people doing it together. I think when I did meditate in a group, it was much easier. Alone, it's harder. And today was very simple. And I really enjoyed that 2 minutes. I wanted more. I was sorry you woke me up.
Well, I hope you weren't sleeping, but you were meditating.
I wasn't sleeping. But
Although there is a benefit to going to sleep too. So
I didn't want to get out of it. I wanted to stay in that place. And when you said open your eyes, I said, oh, I was unhappy.
lovely.
So thank you.
Yes, you're very welcome. And I want to pick up on your comment about doing it in a group. I think we sometimes lose sight of the benefits of what community brings to us. And that whether it's a group meditation, we see that in cardiac rehab all the time. The benefits of being in a space and all of our souls being together in that space. And so I think when you're able to do that, there is here in the Valley, the Insight Community of the Desert offers free. Now you can contact them. They send you a link, and their meditations are longer. They're like 45 minutes, but you can start or stop as you wish. Again, don't beat yourself up over it. But there is a community of people meditating together, and I do think that there is something to that. I think the evidence would show that. So.
Yeah, before I move on to Bill, I was just going to say we just started, I think, 2 weeks ago. Every Monday, there's a half-hour meditation through a Zoom link at the center. Starts at 3 o'clock, I believe. Is it 3 o'clock, Guillermo?
2:30 to 3 p.m.
2:30.
It's only half an hour. I'm going to send the link on the chat group.
Yeah.
I think that's great. And 30 minutes is a nice time. And if someone wants longer, they can stay on, but that's a little less daunting than 45 minutes to an hour if you've not meditated.
Yeah.
That's wonderful.
And so, Bill, how about you with your expectations for today?
He's muted.
There we go. Is that better?
Yes. Hey, Bill.
Hi, Heather. How are you?
I'm good. It's nice to see you.
Same here. Two things. I was interested in obviously the benefits to cardiovascular information and how to be as a heart patient. How can you take meditation and help your general life? And I think we all have some stress at some point, and I've certainly gone through that at times. So anyway, every time I three putt, I know darn well that happens on the golf course. So anyway, the meditation is helpful for that. Secondly, though, I this is a nice public forum, and on behalf of the Mended Hearts group here in the Coachella Valley, I want to thank Karen and all of her staff there at Cardiac Rehab and also in the CHF clinic about all the awesome work that they do. I know both myself many years ago and my wife fairly recently have gone through cardiac rehab. Karen was a dear person to me personally, has been an educator to me on many occasions, and I just wish her so much well-being in her retirement. And thank you for being such an awesome nurse.
Oh, that's so kind. Thank you, Bill. Hi, Carol.
Hi.
Anybody else have anything that they'd like to share about this?
Could I
Oh,
hear
I did.
me?
Yes.
You can?
Yes.
Okay, I'm sorry. This is my first Zoom experience. Could I please get the information for the 2:30 to 3 o'clock? I think it said the center's PRS.
Right. So at the bottom of your screen, you'll see a little word that says chat. Go ahead and click on that chat and you'll see the information will come up in the chat room. Do you see that?
I don't see a chat.
On the very bottom where you have all the icons for the Zoom, there's an icon that looks like a bubble that says chat.
Of course, I'm not seeing it. I don't want to take up your time. I see Candace, she and her. But I'm sorry. I don't want to take up your time.
No,
I
no,
don't see
it's
it on the
very easy. The website is the center C as in Charlie, V as in Victor.org. The center CV.org.
Yeah. And you
Okay.
can read them all there.
Look under life enrichment, and that's what the program is.
Wonderful. Thank you.
Good things too.
Thank you.
Sure.
Hi, I just
Oh, I
wanted to
scared
say that I
myself.
joined the meditation because I'm having an atrial fibrillation ablation on the 19th. And so I'm looking at different ways to fix my tachycardia and atrial fibrillation. Other than taking 3 diltiazem a day, that's making me gain 20 pounds, even though I don't eat any food. And so I'm
Oh,
adept at meditation, but I'm just trying other avenues with my heart issue.
Well, was some of what we talked about, Mark, was that helpful to you? Do you think that there's maybe some of that you could try? Because definitely, atrial fib and even getting through the procedure itself, if you're having an ablation, calming everything down can help.
So it was very, very helpful. I think during the procedure, like at the part after the procedure is where I'm going to be having to meditate all the time when I'm hooked up to the wire. It's basically you're hooked up, you're kind of like locked into your hospital bed because I had an atrial flutter ablation before. And they have the blood pressure cuff and the IV, and then sometimes they keep the EKG on you. And you can't, it's hard to get a glass of water or go to the bathroom just for the period until they let you go in the morning, like at 10 a.m.
So the breathing exercise, if you can practice that before, having something like that post-procedure can really be of benefit to you.
Okay.
And if not that, trying some of the other things or taking your device with you, you can have that after your procedure, and finding an app you like and listening to maybe a meditation or some music, calm, soothing pods, some of those that will help to soothe you. And music, I didn't really speak to music. Music is so powerful when and that was a big part, I think, of our breath exercise, was the beautiful music just sort of carries you along. So that would be a thought perhaps for you to try.
Yeah, that's very helpful. I have the Calm app, and then I have the other one called Headspace, but I usually use Calm.
Calm's wonderful. Yeah,
Thank
different
you.
different choices for different reasons, right?
Yeah.
Yeah.
Thank you.
You're
Okay,
very
we have-
welcome. Good luck.
Yeah, we have about 2 minutes. So if anybody else wants, now is your time to speak up, or if Karen, if not, then Karen, a few last words from you, or so
Well,
feel free to unmute yourself if you have a question or comment.
Then
We're all calm and zen.
isn't that nice? It's a nice place to be a lot of the time. I really appreciate the opportunity to share some of my experiences and some information with you. I do hope you found it helpful. I appreciate those of you that shared information. It's nice to see a couple of familiar faces. Hi, Carolyn, and as well as Bill. And I wish you peace in your heart, and to pick up something to try it. It's really a wonderful tool to have in your toolbox. And if you don't have anything else, I think we're at time. And I thank you so much for the opportunity to spend an hour with you. Thank you.
Thanks.
Well, thank you,
Thank you.
Karen.
Thank you.
Yes.
We
I
see
can
you
all
guys
say,
in 2
yay,
weeks.
very nice job.
Yeah,
Mask
Thank
up.
you so much.
Mask up.
Yep, everybody mask on, yeah. For sure.
Okay.
Thank
Bye-bye.
you so much. Bye, everyone. Join us in a couple weeks.
Bye. Thank you.